ahead and share a PowerPoint with you all. Can you see the PowerPoint slide? Just make sure that worked. Great, thank you. So as mentioned, thank you all again for joining us this morning. Hoping to talk to you about the juvenile justice reform bill that's going before the legislature this fall, answer any questions that you have, and hopefully provide some background about the why and the how this happened. So people in North Dakota and systems have been working on just consistently improving practice and policy within the juvenile justice system for the last few decades, making sure that practice was staying up to date. However, in 2019, a more formal process to ensure this was happening statewide was put into place with the creation of the Juvenile Justice Commission. The Juvenile Justice Commission was created for 6 years to study and improve the juvenile justice system in a variety of different ways, including a review of Chapter 2720, gathering information on issues of child welfare, including education, abuse, and neglect, receiving reports and testimonies from individuals, reporting to be back to the legislator, and then annually submitting a plan to the governor and legislative management with the findings and recommendations for continued improvement. So as part of that first year, the commission, in partnership with the state advisory group or the SAG, created an RFP for an outside organization to help with an initial analysis to take a look at what North Dakota had done over the previous years and where those gaps still existed to focus continued reform efforts on. So the Council of State Governments Justice Center was awarded that RFP. Just to give you a very brief background about who the Council of State Governments Justice Center is, we're a national nonprofit, nonpartisan organization that works across the country with all three branches of government to improve policy and practice and outcomes in both the criminal and juvenile justice system. We've worked in all 50 states, including in North Dakota previously in 2015, and bring that research and experience to bear. So conducting this analysis, the goal was to position North Dakota to develop a consensus-based, data-driven statewide plan that ensured that the juvenile justice system more effectively protects public safety, reduces disparities, and improves outcomes for youth. So to conduct this plan, we reviewed and analyzed reports, including previous annual reports, publicly available data, past juvenile justice system efforts. We also took a look at current juvenile justice legislative code. The majority of that is 2720, but also looked at anywhere else within statute that intersected with the juvenile justice population. Then beyond just what was on paper, also conducted a series of focus groups with key stakeholders, including policymakers, DJS, juvenile court judges and probation staff, prosecutors, public defenders, service providers, law enforcement. We met with education representatives in the spring. I also know Russ Reel is on the commission, so had education voice as part of this process throughout. And then while we didn't have the opportunity to do deep case level data analysis as part of this assessment, we did look to the extent to which North Dakota was able to utilize data to drive decision making, to utilize it to guide planning and service decision, and where those data gaps might exist. Guiding the assessment are four core principles. Those core principles are based off a meta-analysis of all of the best research and data in the juvenile justice system nationally. So looking at all of the research that's been done about cognitive brain development, what works, what's not effective, looking at best practice within states and local jurisdictions, and that's been shown to be the most effective in improving outcomes and improving public safety. And we boiled that down into sort of four key buckets of principles that should guide an effective juvenile justice system. The first core principle is that supervision, service, and resource allocations should be based on a validated risk and need assessment. So what the research shows is that even really experienced professionals struggled to really adequately identify risk on a consistent basis. This is for a variety of different reasons. It's because of offense type driven decision making. It's because of just human influence of if you see a youth over and over again, or if you've seen their family multiple times, it just makes it really difficult to do without that validated tool. And it also is difficult to identify what are the needs that are driving the criminogenic behavior without that support. So We know that a youth can come before juvenile justice system with a variety of needs. However, there are specific needs that are driving their criminogenic behavior in such a way that brought them into contact with the juvenile justice system, and those needs should be the priority in service decisions. So really making sure to identify which those needs are and prioritizing case plans based off those assessments. The second core principle is to adopt and effectively implement programs and services demonstrated to reduce recidivism and improve other youth outcomes. And once again, to also make sure that's being matched correctly with the right level, with the right youth. So oftentimes this gets talked about as evidence-based services, and they can be in that alphabet soup of FFT or MST, and people can say that we don't have that. Really what we're talking about when we say effective programs is that there's some sort of program plan. It has a targeted population. So we know that when you try to serve all youth with the same program, it's not going to necessarily usually be effective. So who is that target population? Who is it designed for? How are you ensuring that the right youth are receiving the right dosage of services? And that data is being utilized to guide that decision and to track outcomes to make sure it's achieving the intended effects. That's what we talk about when we say effective services, not just that it has to be that national program that's been validated in other jurisdictions, but that has been proven to work within North Dakota. And that really that the right services are being matched with the right youth. So not to give every youth who comes into contact with the justice system substance use treatment, but to make sure that they actually have a substance use need, or to give every youth aggression management training, but to make sure that there's an actual need there. The third core principle is to employ a coordinated approach across service systems. This is a really key factor. The vast majority of youth come into contact with multiple service systems in a state, and this is especially true, and this is for when we're talking about education, because most juvenile justice youth are in some form of education just by virtue of their age, whether that's an alternative school, a regular public school, a private school. They're usually in education or should at least be in education. They may be disconnected, and making sure that those service systems are working collaboratively to build case plans that work together and on each other. You'll see in states that a youth could have 7 different case managers across 7 different services, and they could have 15 meetings in a week, and that's just not feasible to keep up with all of those case plans, all of that. And so make sure systems are working collaboratively together, rather than that putting that onus on youth and families to navigate between the systems, making sure the systems are working. And the fourth is really to tailor systems and policies, programs, and supervision to reflect the distinct developmental needs of adolescents. The research on cognitive brain development, as I'm sure you all are aware, is that youth are not just mini adults. Especially, adolescents are hardwired to be testing limits. We know that they're more susceptible to peer influences, that they're less reactive to long-term consequences. So saying you'll go to prison for 10 years isn't really dictating how that's going to change their behavior, and any number of other concerns that tie to cognitive brain development, and that juvenile justice systems must be built in such a way that takes that into account. Whether that's looking at family engagement, whether that's understanding, that sanctions have to be both swift and certain, but also proportional to the issue at hand, as opposed to just longer term sentences, really making sure that that idea that these are not just mini adults and we're taking the criminal justice system and moving it down, but building a developmentally appropriate approach. So within those principles guiding the assessment, our assessment found 4 sort of key takeaways. The first is that North Dakota lacks a statewide vision, purpose, and set of research-based principles to guide its juvenile justice system. This isn't to say that there wasn't progress being made within individual offices or with individual pieces of the juvenile justice system, but that overall there was a lack of a statewide vision. There was a lack of agreement about what the role of a juvenile justice system is, who it should be serving, how it should be serving that, across different service systems, across different parts of the state. Some of that was driven by, and we'll talk about this more later, the confusion within 2720, because it combines deprived, unruly, and delinquent youth into one code. It creates some muddled idea of who can receive what and when, and how services should be provided, what is available to youth, and what is a correct and appropriate response. Sort of building on that, the second key finding was that North Dakota offered limited access to services without formal system involvement and had an over-reliance on residential services. So we heard consistently that the way to get youth services was to refer them to the system. And when we'll talk about this, and Karen will definitely talk about this more, that a lot of what this bill will do won't change access to services for the youth in terms of the service availability and what services they'll be receiving, but it'll be changing the avenue through which those services are being provided. And the research is really clear on why that's important. We know that every step of formal assistive involvement can have collateral consequences and an effect on outcomes, especially for low-risk youth. So just as an example, when it comes to schools, Florida has a civil citation program. They did an analysis that when youth who are eligible for the civil citation program received just a citation, their recidivism rate was 4%. When there was a formal arrest and then diversion and a more formal diversion process, that recidivism rate for the same population of youth was 9%. So just even though they were being diverted to the same services as the citation was providing, just that formal arrest piece raised that recidivism rate from 4% to 9%. So each level of formal involvement has that impact on low-risk youth. And so really trying to sway and change the way that services are being accessed to a way that's going to provide both the public safety and service provision without the potential negative consequences of formal involvement. We also found that North Dakota had limited capacity for evidence-based service delivery, quality assurance, and data-driven decisions. And this isn't to say that, once again, there aren't evidence-based services being provided, but there's little quality assurance and data being used to ensure that it's achieving the outcomes, that the services being provided are sticking to that evidence-based model, that they are serving the right youth with the right dosage. The data isn't there to ensure that that's what's happening. And then the fourth, when this is going back to the first point, was that North Dakota's juvenile justice statute is general, vague, and largely does not touch on research-based principles and practice, and has not stayed up to date with the best research and evidence. I think Representative Kameen can say the exact year, but I think it was last updated formally in the 60s or 70s as a comprehensive review. So it's a little behind what best practice and research shows, and that provides a weak foundation for any of the reform efforts that have been ongoing and occurring over the last decade. And so really looking to improve that foundation for these reform efforts. So based off those assessment findings, there are a number of key recommendations were put forth to the commission. The first was to decriminalize unruly behaviors and develop pathways to serve these youth outside of the justice system. I think it's important to note again that once again, the majority of these youth were being diverted. There's not changing the services that they're having access to. It's changing the pathway to those services in a way that's going to result in better outcomes. The second is to establish more stringent criteria and research-based processes for system decisions, particularly detention and out-of-home placement. We know in the last few years, North Dakota has implemented a detention screening tool, has engaged in these practices, but want to formalize that, make sure it's happening consistently across the state and happening in the right places, and the right tools are being used at the right decision-making processes. The third is to build a more robust continuum of community-based services statewide, so making sure that service gaps are identified and addressed. The fourth is to strengthen statewide commitment to and capacity for evidence-based services, and then really that quality assurance and data collection, that there is data being used to say these services are meeting the needs of the youth. We are looking at what the needs are that are being identified and making sure services are available that match these needs, things of that nature. And then the fifth is to align state statute with system improvement recommendations and more generally research and best practice with the goal of matching youth with the appropriate level and quality of supervision and services. And that's really what we'll be talking most about today is I think number 5 and number 1, but making sure that what the statute says is supporting what is being done in the state in terms of those reform efforts and providing that foundation for successful practice. So I will now turn it over to Karen to talk a little bit more about what this bill specifically says.
Sure. Good morning. If you don't know, my name's Karen Kringley. I'm the Juvenile Court Director for the southeastern part of the state. So that's Fargo, Jamestown, Wahpeton, and everything in between and around. I serve on the Commission of Juvenile Justice, and I worked this summer and this fall on the work group that worked on the bill draft. So you can give me the. This slide kind of goes through a lot of the efforts that have been made in the last few years to get us to this point. And it started off with a visit to the Council State Government State Forum by court personnel such as Scott Johnson from Grand Forks and Justice McEvers and Judge Fontaine and Lisa Johnner. And we won't spend a lot of time here, but obviously this hasn't just come up all of a sudden. We've been talking about making these efforts all along. In fact, when CSG made a visit to our state a few years ago, the juvenile court really moved down where we use our pre-screen risk assessment based on some of those recommendations and really upped the amount of diversion we were doing on low-risk kids. And we've already seen a great results with those recommendations. So taking this forward to the bill drafting process, Representative Clemeen formed a work group, a small work group that started this summer in June, based off of the CSG recommendations to us. And that consisted of Representative Clemeen, Representative Kim Koppelman, Senator Larson, Senator Bakke, Lisa Biergard from the Division of Juvenile Services, Lisa Johnner from the Association, Corey Peterson from the department, myself, Travis Fink from Indigent Defense, and Tessa Vaughan represented the state's attorney's office. We worked throughout most of June and July on that first draft, and it was introduced to the Interim Judiciary Committee. We then received a series of comments from a variety of different stakeholder groups. In fact, I think it was multiple pages, single space long of comments, and we met again and tried to address each of those comments. We revised the bill, and that revised bill was introduced or presented at the Interim Judiciary Committee in September. There will be an opportunity for additional amendments. In fact, our group has been taking in all of these stakeholder comments and making some adjustments as we go with some recommendations for amendments to the bill. The bill itself, one of the key things you will notice if you take a look at it and compare it to our current statute is our current chapter, Chapter 2720, is the Uniform Juvenile Court Act, which was adopted in North Dakota in the 60s, late 60s. And although we've made a few updates and pieces of it, it primarily hangs together all as one uniform code that was adopted. And so really it's like the rule book for juvenile court 1968. So you can see why there's a need for updating and modernization. The other thing that's pretty apparent to brand new practitioners in the system is that when you read Chapter 2720, all of the case types, whether it's delinquent, unruly, or deprived children, are all kind of mixed and interwoven inside that chapter. And that can be very tough for a new attorney, a new judge, a new lay guardian ad litem. Even I think for parents, pro se parents have a difficult time understanding our statutes. So it's kind of like giving the rule book to your new football coach and saying, about half of this book applies to the volleyball team and the other half applies to the speech team. Figure it out. So, I mean, you're reading a sentence trying to decide what applies to what. In the last legislative session, a new chapter brought in the guardianship of a minor child, and that's at 2720.1. And then the Division of Juvenile Services since the 80s has had Chapter 2721. So the proposed bill breaks these different case categories into sections, which will make it much easier for people to use every day in court. Guardianship will stay at the top. There will be 2720.2, the Juvenile Court Act, which is our general definitions and general sections. Then unruly child, which is a term we've used since the 60s in North Dakota, under the bill draft would become child in need of services, or CHINS. And deprived children would become children in need of protection, or CHIPS. And these are terms that are used in other states, acronyms, but it brings a lot of clarity towards these case types when they're separated out into sections. And then for youth who commit offenses that would be crimes for adults, all of the delinquency will be in Chapter 2720.4. And a lot of what we're doing is updating our definitions. So a lot of the practice that we do today and that school principals are familiar with, such as graduated sanctions and restorative justice, a lot of those terms, attendant care, we don't have in our current code, and we're updating those definitions to include the language we use every day. We're also bringing some clarity towards roles and responsibilities. Our current chapter is silent about what people are doing what. So it might say, the summons and petition are served. It doesn't say by whom. So it just, we're bringing a lot more clarity towards who is responsible for what part of the case. And talking about unruly youth. So like I said, it establishes this child in need of services as a separate legal category, and it decriminalizes them. So it really separates them out from the kids who are committing criminal acts. As you know, currently in North Dakota, all of the unruly definitions, they include truancy, running away, ungovernable behavior, use of tobacco under the age of 14, and minor in consumption, minor in possession. The bill draft as it currently stands has all of those except for MIC and MIP being referred to the zones. And as Jacob said, the pathway changes, but the services will not. Most of those unruly kids, I think it's as high as 80, 81, 80 to 85%, are diverted by the juvenile court system to services. And most of those kids never reoffend or come back. It's a small percentage. And some of the ones that we do see for informal adjustments, we're basically case managing them, which can be handled by the zones. Right now, we're considering delaying the start date of that change in order to do more planning around what the process will be and the pathways and the services available. The bill draft itself also has some more firm language about how to make a referral to the juvenile court for things like truancy. It requires schools to give us more information about what efforts they've tried and whether the child is currently on an IEP. It's really helpful for the providers to know that type of information. And the bill draft as it stands right now has a sunrise clause that says that on August 1 of 2023, schools would be limited from referring youth for infractions and misdemeanors committed on school grounds, with some exceptions like domestic violence and drug possession. So we're continuing to talk about that. But as Jacob said, we know that low risk youth, once we bring them into the formalized system, they're more likely to drop out of school and not complete, as well as more likely to recidivate. The statute itself requires that validated risk assessment. We in the courts have always used a validated risk assessment, but it's validated for delinquent youth. And while we can use it with unruly youth, it isn't designed for them, and it mostly just measures needs. And so we need to look for a validated tool to triage those unruly or soon to be CHINS kids. One of the things I'm most excited about is the bill draft itself broadens the right to counsel for children in all case types, and specifically gives a presumption that children charged with a delinquency will have the right to counsel. And I think that's critical. For those of us who work in the court system every day, we see youth, as young as 13, 12, 13, 14, waiving their right to counsel on their advice of their parents. Making admissions to things as high as felonies, things that could affect them, even their liberty being placed out of the home. I've noticed even in my lobby, parents will say, I can't take another day off work, so we're not coming back to get an attorney, or I can't afford to get an attorney. I don't want to fill this out. And you have 12, 13-year-olds waiving their rights and basically representing themselves against our prosecutors in the courtroom. So that right to counsel, I think, is critical. I think for those of us in the system too, we're excited about that'll really reduce continuances. So many times that first appearance, sometimes you'll see a request for counsel, and then there'll be another appearance, and then the attorney needs to get prepared. So there's a lot of delay. So to have the attorney appointed right up front would be really critical. Like I said, it requires that risk and needs assessment. We're going to do more of a pre-adjudicatory assessment, like a pre-sentence investigation on the adult side somewhat for delinquent kids, just to make sure we're matching services to the right level and to their needs. The bill also somewhat reduces the length of probation and doesn't allow minor probation violations to be used to kind of bootstrap kids up into the corrections system. So there's limitation on the use of minor probation violations. By the bill, we're required to use graduated sanctions and incentives, and we do that currently, but this brings us into the statute, so it's right in front of judges and attorneys as they practice. We also have decided as a work group to put into the bill a specific statute on the Indian Child Welfare Act, which is a federal law that's been in existence since the 70s. But by putting that specific language right in our state statute, it'll be right up front and center about the work that agencies need to do to keep Native American kids in their homes. So. As Jacob mentioned, there's more clear language around the limited use of secure detention. We've all gotten used to the use of the detention screening tool now, but it really narrows down when detention can be used. We know that detention tends to make youth unwell, so we want to only use that for kids who really pose a public safety risk and not just for needs. So we want to develop and expand our use of alternatives to detention. Like I said, it limits that use of probation violations to bring a kid into DJS. So just minor curfew violations, for example, shouldn't cause you to be committed to the division. And the bill itself also will require a planning process so that we can strengthen all of the services that we really shouldn't have justice by geography, but that kids in New Rockford are entitled to evidence-based programming just like kids in Fargo. So we really want to spread programs, strong programs across the state and not just have them in pockets where we're able to deliver them currently. So.
Thank you so much, Karen, for providing that. I'm going to go ahead and stop screen sharing. So really, the purpose of this call is to provide you all with the opportunity to ask any questions, get anything clarified, talk through any concerns that you may have with this bill, or raise those to us to make sure that we're not doing something that's not going to work. I know we've heard from a few other conversations. This is a part of an ongoing series of focus groups that we're having with law enforcement, SROs. We met with prosecutors yesterday. So really trying to meet with all those key stakeholders and make sure that what was drafted, what is going to match what needs to happen on the ground, and that we're addressing any concerns that people have. I think we've heard a few things percolating up about some concerns. So would love to see if anyone has any questions for us about this bill, whether that's the research, the process. I see we have, if you want to raise their hand in Teams, if you know how to do that. Or I don't think we have too big of a group today. So if you just want to unmute and jump in, please let us know if you have any questions.
This is Steve Madler. I'm principal at Century in Bismarck. And I guess one thing, maybe a clarification, the comment that you made, Karen, in regards to domestic violence, is that two kids that are fighting? Is that the type of domestic violence you're talking about?
We're talking about these simple assaults that result in injuries. So you might have restitution issues, some of those. So we're kind of trying to distinguish between maybe like pushing and shoving in the milk line versus, a fight where you might have a medical bill involved, right?
And so my next question is probably more to do with some of the unruly, the ungovernable student, the truant student. And has some of that work already been being done where students, it's a status offense and they're not getting services in the juvenile system now? The schools continue to give them truancies, keep filing truancy, and there's a drop off of services right now, because that's the feeling we have as a school. We have an incredible spike in the number of truancies that are being filed, and they are students that are in the system, I think, but it appears that there's not any additional follow-up or any additional programming put in place for the students from a support side. So as schools, we're working with families, we're working with the kids, we're trying to get them to come to school, and they out and out refuse, but it keeps going on, not just weeks on end, but months on end.
Yep.
And the standing joke amongst schools is, well, they're within 8 months of their 16th birthday, they're just going to ride this one out. That's, just being honest, that's a standing joke amongst administrators. And so what can you tell me about that piece of it?
Yeah, I mean, certainly the more we know about the science has taught us that we shouldn't put truancy kids, in a delinquent class, a high-risk class with kids who are committing burglaries or robberies. Certainly, we've been diverting about 80% of those to programming, and it depends on what area of the state you're in. So for example, in Fargo, we tend to divert all first or second time truancies to YouthWorks, and the courts pay for a program over at YouthWorks where they, take a look at what's going on with the kid and see if it's a barrier for transportation, if it's mental health. As you all know, I mean, truancy is a very complex problem. I would think my staff would even tell you they would rather have a burglary case than a truancy case, just because they're clear. What drives truancy can be so different. It's really a family based problem. And I think that's why in many ways we think having the zones triage these are better. My staff are probation officers and they tend to have criminal justice degrees and are trained in that way. And so to have more of a family assessment model, Corey's staff can provide the same types of training. He can have better training of his staff. He will probably be looking at assessing those and triaging them just as we do, but they'll have that family model. You're right. We have been doing some pullback. I would say we haven't seen a great increase in the number of truancies reported. Last year, statewide, there were 331 truancies reported to the juvenile courts. I just took a look quick this morning just at Fargo, just to take a look. Last year, from August to December, there were 64 truancy referrals. And so far this year, it's felt like a lot, but it's 48 in Cass County. So, but like I said, 48 thefts. There's sometimes more clarity about what needs to happen than those truancies, but we're really looking at Corey's staff, the zone staff. They can case manage like we have done with deeper end truancies, where they continue. We have had kids on non-reporting probation who are assigned a juvenile court officer who stays in touch with the schools. But I think what Jacob would tell you, what the science would tell you, is that using those skills that we use with really delinquent criminogenic kids isn't appropriate for kids who are only being truant. Now, we may have kids who are both delinquent and unruly, like truant, skipping school and stealing a car. Stealing the car will still be referred to the juvenile court under this program. But I think in all of these stakeholder groups, what we've really learned is that we need to do some more planning about what types of services would be best and what would be a great tool to triage these kids. In some areas of the state, there are truancy review attendance boards where the schools work kind of hand in hand with the social service worker and the juvenile court with the parents and families to try to figure out what's going on. Other places, I don't think have truancy attendance review boards, but I know, Corey, you can interrupt me if you want to tell them how you can provide better services and we can.
Yeah, I appreciate the question, Steve. So Corey Peterson, Director of Children and Family Services at DHS. The one thing I would say is, as everybody on this call knows, historically kids that are truant usually are not truant just starting at 15. That's been an ongoing issue of educational neglect and ongoing issues with the family, just disengagement and all in total with the educational system for a number of reasons. So I think one of the things we've talked through a little bit with the zone staff and even on this committee is the zones will see that educational neglect family, much early on, second, third, fourth grade. Hopefully we can start getting better engagement there so we don't have a truancy issue down the road. I do think, though, if we do a delayed implementation, we would want to, include the educational leaders around how and what services we could work together with to really engage this group of kids that disengage with school. Because I think it's a real issue. It's just usually it's early on and it really festers itself at 14, 15 when you guys get them in the high school level. So.
And so from a school standpoint, and one of the things I'm wondering, Karen, you gave those numbers, and do those numbers match the numbers of truancies the schools report to the state? I wonder if there's some commonality, because we're at 52 this year, just my building. There were years we were only at 4. And so when I say there's this incredible spike, and the awkward part for us is,
this year's been super tough, obviously, with this whole distance learning thing. Don't get me wrong. Yeah.
But from a compulsory attendance standpoint, we feel obligated to follow the letter of the law and file a truancy every time we get to X number of absences. And then it gets moved along and it seems to be a void, or I don't know if it just gets stacked on or how that falls apart. But it just seems that the next step, or the kid that gets not one, but two, now this is their third, and there's not been a defined intervention. It just keeps us spinning our wheels. And so,
and maybe, maybe the juvenile court isn't the best model to address truancy. Maybe we're not the ones to enforce the compulsory attendance. That's the way the 60s law set us up, but maybe that isn't the best intervention. I don't know if the numbers matched. I can certainly give you the court numbers. One of the things our court database does is it spits them out by county. It doesn't spit them out by school district. So it's kind of a little hard to sometimes make those match up, but I'd be happily share those. But I agree. I think one of the things we've done is tried to like triage and delay stepping in with everything we've got, not use all of our weapons until they, things are so deep and we do need to court manage them. But maybe that's because the juvenile court isn't best suited to enforce the compulsory attendance law.
I would jump in, Karen, to say that research shows that it's not. And I think that this is what some of this bill is trying to do. It's to say, right, like what we're hearing from you, Steve, and from other principals, is that there's a need to have a more effective intervention and a better pathway to services. But we know from the research that juvenile court is not the way to do that. CSG actually just this year finished an assessment of data in South Carolina looking at truancy and found that youth who were formally referred into the system actually then attended school less days over the ensuing year than youth who were not referred. That's, it can be for a variety of reasons. And it was like 5 days. It was a marginal difference. So the real takeaway is that it had no impact on attendance. But if there was a formal impact from system involvement for truant youth, it was in the direction of less school attendance, not more. And that's because of things like a probation officer checking in on you at school and the stigma that's attached with that. Then teachers know that youth is in the juvenile justice system, but they might not know the reason why, and that they can lead them to getting kicked out of class sooner, things of that nature. And so we know that formal involvement actually does not improve with the juvenile justice system, does not improve going to school. So it doesn't even address the issue. And then we also know that formal involvement can lead, if they're being put with delinquent youth, can then lead to an increase in negative behaviors and then formal system involvement down the road. And so want to make sure that there is that intervention happening and there are those services being provided, but it's done in a way that's going to actually impact outcomes and reduce truancy. And so that's the purpose of this bill, is to think through how, through the human resource zones, these resources can be given maybe more efficiently, more effectively earlier in the process, because people don't want to involve juvenile court when they know a youth isn't a public safety risk. And so maybe people are more hesitant to access those services because they know the way to do that is a truant petition. They don't want to do that. And so this is actually an opportunity to get to services in a way that people aren't worried about bringing in that formal involvement and those consequences. So it may even be a better avenue to services than currently exists, and it makes those services more effective in their utilization. And so that's really the purpose of this bill. It's not to say that a truant youth doesn't need services. It's to say, how can we get those services to that youth and that family in a way that's going to lead to the best benefit with causing the least amount of harm. And so, we know from the research that juvenile court is not the answer to that question for a truant youth. And so finding that pathway, as Karen mentioned, there is, the extended implementation date on this. So this isn't going to be happening day one. It's going to be conversations with you all about what is the way to establish that referral process, that service process that's going to work effectively, and getting that set up. So there's not a gap where you can't, make a truancy petition, but you still don't know how to access the human resource zones. There's going to be that implementation plan to make sure that gap doesn't occur. But the overall purpose is to build that bridge to services in a more effective way. So I hope that answers your question, and we're happy to continue working with you on making sure that the needs of those youth are being met, and they're just being met effectively. I see Jason had his hand up.
I did. Thank you for your time and thanks for the information. Greatly appreciated. Corey, I'd say Corey, Jacob, and Karen. I think we all understand that truancy, when we're just talking about truancy in and of itself, is something that's practiced as early as coming out of an elementary division myself. It's practiced as early as elementary school. So kids don't just decide to be truant in high school or middle school. It's something that they've learned over time, and so totally understand that. Jacob, you started to answer my question in your last response, is why I dropped my hand, but I will lay it out there. It does sound like the bill, and I want to be very transparent that I haven't read the bill in its entirety from start to finish either, but have perused it. It sounds like what doesn't work is there's a lot of discussion about what doesn't work in the research, Jacob, and you've done a great job of laying that out for everybody. My question would be around what does work, and you're talking a little bit about handing this off to our, I believe, I don't know if it's inherent in the language, it's my interpretation that it's being handed off to county social service zones as well as human service centers. And so what is the intent on trying to shore up that, the services and the opportunities within that really is going to try to make a difference for this? Because this is I would say, a substantial issue. So that would be question number one, is what would that look like? And then the second question is when you do decriminalize a lot of these things, the truancy, the tobacco, the unruly, and what happens when you start to see compounded, these are risk factors, if we call them, if we want to call them risk factors, but what happens when these non-criminalized pieces, you start to see a student with multitude of truancies, multitude of tobacco violations, or multitude of unrulies? Is that still something that you will take care of through that you're proposing will take care of through these human service centers or county social service zones or within a community?
Yeah, I can address some of that, and then turn it over to Karen and Corey. I think we can talk a little bit more about what's happening on some of the services. But the answer is yes. The goal of this is to make sure that those services are being provided and are matching and needing what's being sent to them through those human resource zones. So that is part of the implementation. I know Corey can talk a little bit about what's happening in terms of service rollout, service delivery, making sure that they're providing the right services and have that available to the community. That's all part of an overall plan within North Dakota. It's not specifically addressed in this bill because this is focusing more on just the juvenile justice piece of it, and not on then the service delivery provisions that are associated with it. But that's not to say that they're not a part of the conversation. They're not being discussed. I apologize. I forget the exact name of the Department of Mental Health or Behavioral Health within North Dakota that's being led up by Pam. Just rolled out a new way this summer to service delivery. So there are those things happening in North Dakota, and they are being addressed and are part of the conversation, even if they're not explicitly spelled out in this specific statute. I don't know if Corey or Karen, you have more to add.
Well, I would just add, I appreciate the questions. I think I would add a couple things. One, I just want everyone to be clear. These are not brand new families coming into our system. We've created a new law that are going to capture more kids. These kids are already in our system. We know them. Zones know them very well. Actually, just because they're our truancies doesn't mean there wasn't educational neglect or abuse neglect in the past. And so these aren't new families that have never received service. They actually are getting services now. We're just not sure they're getting the right service or timely service. So hopefully, as we build this and get everyone's support around, what that looks like, the screening and the service delivery, we can get better services more timely to families rather than, wait till they get a referral to the juvenile court.
And without needing an arrest.
Right, or being arrested. The other piece I would mention, and I know I've worked with the Bismarck Public Schools a little bit around, the state has approved, got the approval from the feds on the Families First prevention plan. And so we can start using federal money now for at-risk kids that are not removed from their home. You know, in the past, we would use that federal money for foster care. We have service delivery approved to be provided in the state. We will hopefully be funded fully for all those things. We're going to get the providers on board in January so they can provide, you know, these evidence-based models within our communities more regularly, and we can, you know, capture the federal money prior to kids being removed from their home, unlike in the past when we had to, you know, remove a child before we could get those federal monies to, you know, give them resources.
Yeah, the bill itself, it allows parents to access services without having their child arrested. So many times right now, you know, a parent will call for help and, you know, they'll be directed, you know, call the police department to respond and, you know, write your kid up for possession of a pot pipe in order to get access to some of the groups or services we have. And you shouldn't have to get arrested to get services. We want to really move the services ahead of the arrest to try to prevent the arrest from happening. So.
See, Steve, you got your hand up.
Yeah, and you know, Corey, you kind of mentioned a little bit about some of the access to federal monies, but I'm hearing a lot of services and programming, and know that every time anybody brings up services and programming, it takes funding. And so we're going into a legislative session and we're introducing a bill, and what kinds of funding is going to be tied to this? Are they going to not only say we're going to reconstruct our archaic, if I can use that word, juvenile justice practice or our language in our laws, we're going to change those, but to get them to work the way we want them to, it's going to take this amount of funding. Is that going to be a possibility?
So I can speak a little bit to that on the Families First. So this isn't always popular to say, but I mean, really Families First, the federal legislation and law basically is about families first, not placements and facilities first. So when we think about that, what we have to think through is that really paradigm shift around, okay, if we reduce foster care by 10%, the state's going to save $10 million. I'm just making these numbers up at the moment. You save that money by not removing every kid that we feel, you know, is doing whatever. If we can provide a service rather than foster care, the state's going to save enough money to roll that money to the front end. It's quite a paradigm shift for people to think about, because many times we're wanting to talk through, what do we do with this kid now, right? We're in a crisis. What do we do? And, you know, is it a placement? Is it foster care? That's always North Dakota's first response is, let's take this kid and put him somewhere, rather than, can we provide a service in their home? So for example, some of the services, if we roll that money up correctly in the next year, which I think we can, and save that foster care money and roll it to the front end for services, some of those services that are already in place in communities can be used and broadened to get more of them, like functional family therapy, multi-systemic therapy, Healthy Families America, nursing family partnerships, parents as teachers. You can use those programs right now, and they're being used right now, but now we can capture the 4E money so we can broaden the service array to all communities and providers, rather than just, you know, the Fargos and the Grand Forks and the Bismarcks. We'll be able to have more services statewide. I don't know if that answered your question, but the money should be there if we do this properly and stop using facilities as the only answer to kids' treatment. That's what I would tell you.
And then, so that those things are happening, who has oversight of how it goes? And, you know, as a school, and I realize some of this is community-based, but those things that happen in the school, where is the school at the table in constructing what those services are?
So my office oversees the state plan that the feds approved. My office would be the ones that receive the federal 4E money. Where schools can come in place, and I've worked with a couple people in the Bismarck Public Schools around this, is, you know, if you have a master's level social worker that's trained in functional family therapy, they could provide that service in the school for families if they want to. I mean, we really have to the thing I guess I would say is we all get public money. We all pay our staff with public money of some sort, if it's local, state, federal. I think we have to make sure we're utilizing our resources together to better serve families. But schools can access that with a simple case plan. A kid with an IEP have a case plan, providing services to the home, or just a referral process where the schools could refer a kid to functional family therapy in their community, and there'd be providers to provide that service, or in-home supports. But the school could be a referral process rather than providing the service. They could refer the family off to a service, and then that service could go to the home and provide services.
Can you talk to about like the mobile crisis units and how those are supposed to be statewide and they could de-escalate situations like in a crisis? Is that
I wouldn't be my area to talk about. I would tell you that my understanding is the mobile crisis team are starting to roll out. I don't know where they're all at this point. I will tell you that I met with a small group in Bismarck, and the human service centers were a part of that, talking about the mobile crisis team. I know they met with law enforcement as well, so those things are coming. I'm not the person that
don't know the details. Yeah,
I don't know the details.
Our hope is, though, to have a behavioral response instead of a law enforcement response if it's a crisis on that particular day, so that you don't have to have a kid cuffed and taken to detention for causing a disruption in the classroom. Perhaps you can have more of a behavioral health response in that type of situation, or at home on nights or weekends with unruly kids. So.
And I know we're almost at the top of the hour. I don't see any additional hands raised right now, but if anyone has any last questions, please feel free to reach in. But something we've heard is that there's been some concern that this bill is an unfunded mandate for schools, and I think we want to be clear that this bill isn't asking schools to take on service delivery that they're not already doing or do things that they're not already doing. It's making sure that when those services are being accessed, they're being accessed in a way that does not involve formal juvenile justice system involvement, because we know that that's not an effective way to provide those services. So it's finding that new avenue and those new supports and that new process for getting services to these youth and family in the most effective way that's going to lead to the best outcomes. Is not saying schools deal with it on your own, you no longer have support, and it's not dramatically changing the services that are available to those youth and families. So really want to make sure that this is a collaborative effort, as mentioned early in the presentation. It's about systems collaboration and systems working together, but it's about putting the needs of youth first and using what we know in the research and evidence to drive best outcomes, both in terms of engaging schools and getting to those positive outcomes, and using that information to drive decision making. So like I said, really appreciate everyone taking the time to speak with us this morning. We know there's a lot going on in the world. It's early in North Dakota. You all are definitely going to be continued partners in this. With the delayed implementation, there's going to be that planning process in terms of what the referrals look like, how that all works. And so we'll need your own support in making sure that that's going to work for schools. That's going to be an effective measure. So appreciate your continued support with this and an ongoing partnership. I see Representative Commission was hoping to add.
Yes, I just wanted to add a couple of things at the end here. Thanks for coming in today. I will be, I'm the chairman of the House Judiciary Committee. This bill will be coming before the House Judiciary Committee for hearing. We don't have a date yet, of course, but it'll be sometime in January. And we're, expecting that that once we get this bill passed, there will be, for the schools in particular right now, a delayed implementation date of 2 years until 2023 in order to get the planning process more solidified and is exactly how everything like that will work. And it's as was stated, we're trying to get away from punishment and rather into rehabilitation or use of behavioral health instead of a law enforcement response, as was stated by Karen. So we appreciate your attention today, and we hope that if you have any other comments, you'll let us know, because we are still working on this bill. It's most of this bill, it's a very long bill, but most of this bill is the existing language just been reorganized. So thanks for participating today.
Representative Clemene, I just wanted to comment, this is Jason in Bismarck, that greatly appreciate your work on this. In addition to the delayed start date on it, as long as we have, 2 to 3 years to really try to figure this out and shore up the questions about what does work versus what doesn't, that's going to be very important to Bismarck schools, at least speaking on Bismarck schools' behalf. In addition, on page 65, I think there's some great things that Bismarck Schools is well positioned on in this bill in regards to making sure that we do all that we can for these children before we seek services, whether through the juvenile justice system or our social work zones or our county social service human service centers. And I think that's a little bit of a fear right now. But Representative Clemene, maybe 2 years from now, we'll be at a point where this really does solidify itself.
Well, and I might add, before that effective date comes up, we'll also have another legislative session. So, if there's some tweaking that we need to do on this statute, we'll have that opportunity then in 2023. As was stated, we enacted this law in 1969, and 50 years have gone by, and it's been largely the same thing. There's been some piecemeal changes to it, but it's a lot better organized through dividing these up into these chapters rather than having one whole chapter that just covers a conglomeration of things. So hopefully it'll be easier to work with.
Okay, well, thank you, everybody. I don't know if Lisa, you want to say some parting words?
Yeah, I was just gonna, again, thanks everyone for participating, and I did put the link to the presentation and the recording in the chat box. If you have any questions, feel free to reach out to me.
Thank you, everybody.
Bye. Bye.